On Sunday, 23rd July, Sierra Leone's Ministry of Health received a delegation of 3 medical doctors from the Hunan Provincial Maternal and Child Health Hospital in China, with support from the United Nations Population Fund UNFPA and the government of the People's Republic of China. Speaking at an event to welcome the visiting delegation, Minister of Health Dr. Austin Demby noted the long-standing ties of cooperation between the People's Republic of China and the Republic of Sierra Leone, and expressed his thanks to the government of Sierra Leone and the visiting medical team for their support to Sierra Leone. Ambassador of the People's Republic of China to Sierra Leone, His Excellency Wang Ying, expressed delight that through the South-South Cooperation Partnership, China has helped to strengthen capacities to manage cervical cancer and improve the health of women and girls. UNFPA's representative to Sierra Leone, Nadia Rashid, highlighted that the South-South Partnership Initiative is addressing one of the most preventable forms of cancer, stating that cervical cancer is a devastating disease that is largely preventable and treatable if it is detected early. The team was in the country to provide technical support and trainings to strengthen management of cervical cancer as part of a global development and South-South Cooperation Fund project initiated by the government of China and UNFPA in 2020. The project is helping to reduce preventable maternal deaths by improving reproductive health care for women and girls and strengthening prevention and treatment of cervical cancer. In a related development, the Ministry of Health, in partnership with the United Nations Population Fund (UNFPA), on the 9th day of August 2023, launched a national policy and strategy for the elimination of cervical cancer, a 5-year roadmap on eliminating cervical cancer with a focus on scaling up the screening, treatment of women, and the vaccination of young girls. The launch of the strategy was preceded by the certification of 24 healthcare workers after completing a 2-week intensive training in the management of cervical cancer as part of a South-South cooperation between UNFPA and the government of the People's Republic of China. Following the 3-week visit by the medical team from China, 12 Sierra Leonean healthcare providers will be traveling to Hunan province for additional advanced training that would enable them to continue to strengthen the national capacities to manage cervical cancer in Sierra Leone. Cervical cancer is a major cause of mortality and the second most frequent cancer among women in Sierra Leone, with an estimated 400 women dying of the disease annually. Through the South-South Cooperation Project, Sierra Leone has established cervical cancer screening and treatment services for the first time at 9 public health facilities. As a result, more than 4,100 women have been screened for the cervical cancer, and thousands of women and girls have been reached with information to raise awareness on sexual and reproductive health, including cervical cancer.